Welcome back. Thanks for staying with us. 1.5 million new HIV infections were recorded in 2020, showing that the virus is still a major global health problem. Women and girls in sub-Saharan Africa accounted for 63% of all those new infections. To address this public health concern, senior scientist at the Center for the AIDS Program of Research in South Africa, Dr. Lenine Liebenberg, joins us now. Dr. Liebenberg, thank you so much for your time. Happy Women's Day. As we speak, the numbers when it comes to people living with HIV have shown an increase according to the numbers of 2020. And right at the beginning of COVID-19, various medical and health experts expressed a lot of concern with people living with HIV and other chronic conditions taking a backseat and the focus being entirely on COVID-19. What were your experiences and observations as those calls were made for those people living with chronic conditions not to be ignored because of COVID-19?
Thanks, Mpo. It's good to be here. Thank you for having me on the show. I think the data coming from KwaZulu-Natal does show that there was initially, during our early stages of lockdown, quite a problem with access to treatment or testing facilities, and we saw a reduction in people being able to be tested or being treated. So that did definitely affect the current HIV pandemic. Luckily, fortunately, it has settled since. We've also seen that some healthcare workers had to be rerouted from a focus on HIV treatment and prevention in SRH services, more towards COVID treatment and, I guess, vaccine rollout and prevention. So there was not as much focus on HIV, in my opinion. I do hope that it will change, considering we are facing multiple global pandemics, not only COVID. There is also no cure for HIV. As you mentioned, the HIV our numbers are still increasing in South Africa, or still high in South Africa and worldwide. COVID has had an impact. Vaccination, hopefully, or COVID vaccination hopefully should have an impact on the approaches to treatment and prevention of the other global pandemics in the world.
And how has HIV affected women in South Africa?
Well, women in particular are definitely disproportionately affected by HIV. Women in sub-Saharan Africa, especially so. I mean, in South Africa, there are almost double the amount of women and girls over the age of 15 living with HIV compared to men and boys in that same category. And data from here and elsewhere also indicates that in sub-Saharan Africa, adolescent girls and young women are particularly vulnerable, considering that even though they represent about 10% of the population, they account for 25% of new infections. Now, there are various behavioral, relational, structural reasons for this increased risk of HIV infections in women and young girls. For example, gender inequality, gender-based violence, socioeconomic conditions, etc. My research focuses on biological reasons that may increase the risk of HIV infection in women. I think if we have a better understanding of the way the body protects against infections and damage at the genital tract, which is the site of the predominant route of infection of HIV in women, this may be useful in the design of biomedical interventions to prevent infections, especially in our populations most at risk of HIV infection, our women and young girls.
Just going a little bit backward there to talk about the correlation with HIV and COVID-19, the World Health Organization says that people living with HIV should be prioritized for the COVID-19 vaccine. And when it comes to the risks of developing severe or even fatal COVID-19. What are we looking at as we look at one person who's HIV positive and the other who's perhaps HIV negative?
There is data, some data in South Africa, some data from England showing that there is an increased risk for a COVID infection and severe disease in people with comorbidities, including HIV. So the World Health Organization is absolutely correct in saying that we cannot forget as a population, as a global population, that there is another pandemic out there threatening our public health. HIV infections need to still be controlled. There is no cure. Yes, COVID is very important, but there is still a risk that HIV infections could also increase COVID infections and severe disease.
And how has your research changed the manner in which women are affected by the virus?
Well, my research is focused predominantly at the genital tract, trying to understand why women are more susceptible to HIV infection. And I've done a lot of work on genital inflammation. Normally, inflammation is good. It's the way the body protects itself from infection or from tissue damage. But in the case of HIV, this virus tends to infect the kinds of cells that are recruited to get rid of infections or clear tissue damage, these CD4 positive T cells. So HIV has a better chance of infecting a woman who happens to have genital inflammation. So based on that, much of my research has been focused on what causes this genital inflammation. And we've had a couple of successes over there. Figuring out what causes the inflammation would, of course, then result in ways to control this inflammation to perhaps reduce the risk of HIV infection. For example, I've shown that human papillomavirus, which is another very important virus that can cause cervical cancer, so specifically related to women, has the same sort of inflammatory profile as women at risk of HIV infection, which means that we need to broaden our vaccine coverage for human papillomavirus, as this might have an impact on HIV risk as well. I guess another way would be contribution of my research is the focus on the genital microbiome. We're learning more and more about the kinds of bacteria at the genital tract and how these can promote HIV infection. So taken together, the research focuses on understanding genital health and improving genital health in order to reduce the risk of sexually transmitted infections.
And how has the country been responding to HIV, especially during the past 500 days with COVID-19 being at the forefront? And I ask this also in consideration with the kind of messaging that we were used to seeing and observing when it comes to HIV, safe sex saves lives, and all sorts of catchy phrases. Where are we standing now?
Well, we have had a history of disappointments in terms of HIV treatment and prevention, but nonetheless, there have been many successes. Now we know that despite the number of new infections being high, there's been a steady decline in these numbers over the past decade, and this is predominantly due, I think, to a focus on a rollout of treatment and improved access to treatment, encouraging the population to know their HIV status, to get treatment, adhere to treatment, and promote viral suppression. I think we can also do much more in terms of getting partners involved. I think it's not enough just to tell a woman, get tested. Perhaps say, can you bring your partner along with you? Let's encourage more male involvement in sexual and reproductive health services. There's loads of evidence to show that a partner involvement leads to better reproductive health outcomes for mom, baby, or women in general. So I think there can be some more messaging around genital health and partner inclusion.
And when it comes, I know things have changed quite a lot, and issues of stigma, I'm hoping, are a lot less than what we saw as opposed to 20 years ago. How has that now changed when it comes to society and communities and conversations around HIV and, all the attachments that we saw earlier on as opposed to what's happening in 2021?
I think that we still do have stigma and discrimination. I'd like to think that it's not as bad as what it used to be. But the fact that we still see high risk, high infection rates of HIV in key populations, such as sex workers, men who have sex with men, it does imply that there is a sense of stigma associated with HIV infection. In my experience, working with adolescent girls and young women, I find that pregnancy seems to be more of a worry than HIV as well. So it tells that the discussion regarding HIV is not widespread. It's definitely not to the point that we need it to be to prevent new infections. So I hope I covered stigma and the discussion related to HIV. Yeah.
It's quite interesting that you say in your observation and your work, pregnancy is more of a concern than getting infected with HIV. That really is a huge concern when you take a look at, the ripple effects that could have in terms of new infections amongst young people.
Absolutely. And, I don't want to put my head on the block here, but based on my discussions, I would think that what you're saying is touching a nerve. I mean, people, from what I've seen, the fear of pregnancy, there's a contributing factor to that is that people think, okay, there's treatment for HIV.
Yes.
I could just, continue and I'll be okay. I know loads of people who are okay, but there's a cost associated with that to the government, to the individual as well, and immunological cost too. So I think that the messaging related to HIV needs to change, as I was saying. Have further discussions regarding genital health, gender-based violence, the other behavioral, relational, structural issues that do contribute to HIV. We cannot ignore that. I'm seeing more and more that I cannot only focus on the biological aspect of HIV risk, that there is the synergy between these various structures. And those sorts of discussions need to be had, need to be publicized. And I think only then, when there's more realization, more responsibility, more accountability, more access to treatment and information, more focus on genital health, on sexual and reproductive health, more focus on partner inclusion, reduction in gender-based violence, will we see an impact. I mean, I look at my two boys. And I feel there's very strong responsibility to raise them to be responsible, to be respectful of women, respectable young men, and to be productive members of society in order to ensure that sexually transmitted diseases, don't get spread as widespread as we currently see them.
Thank you so much for your time. A pioneering woman researcher focusing on HIV, Dr. Lenine Liebenberg, bringing us some insights into the research she's conducting and the impact of HIV, people living with HIV, and of course presenting some solutions.